Hello, my name is Dr. Zappaterra, and I am the medical director of our multidisciplinary programs here for chronic pain at Synovation Medical Group. Today, I'd like to discuss with Diane, a patient who actually went through our functional restoration program, which is our 4-week intensive 80-hour multidisciplinary program for patients with chronic pain. Thank you very much, Diane, for coming today.
Thank you. Glad to be here.
I just wanted to ask you, what was your experience of the functional restoration program?
I have to say it was very much, I want to say, fantastic for me. It was helpful in my daily life. It was helpful with my mental state and emotionally, and it really showed me that there are alternatives to dealing with pain without taking medication all the time. So I enjoyed coming and interacting with the people, but most of all, I enjoyed the notebook and going through the notebook and really getting an understanding of how I could help myself. Because you come to the doctor, but doctors are not with you all the time, and you can't pick up the phone and call them, but they do give you a reference guide that you can refer to and go back and reread the information, which for me was really helpful because I could always go back and gain a better understanding of what it was that you talked about in the class when we had our meetings.
Now, if a patient came up to you and said, Diane, what is the functional restoration program? In your words, having gone through it, how would you describe it?
You know what, if someone came to me, and I actually, to be perfectly honest with you, I just spoke to a woman the other week about the Synovation Group and what I had been participating in here. And I think the one thing that people are looking for is how to deal with pain and how to live a healthy daily life. And I think the first thing that I would say to them, as I said to her, was, I know something that would help you on how to deal with your pain, and so that you don't have to take pills every day all the time. And the one thing that I said to her was, you have to move your body. And that's what we're not doing. Once we get past 60, it seems like something in our mind tells us that we need to stop moving. But in essence, we really should do the reverse. We should really continue to move as much as we possibly can, because that seems to be the key as to what helps. I explained to her how there were times when I could hardly walk because my left hip is giving me a bit of a problem, and that by my exercising and doing the movement and continuing to move and making sure that I do the stretches, it helps me. It has helped me to sleep. It has helped me to go off some really harder medications, stronger medications than I was on before. I do still get a medication, but I don't take it as much as anywhere near what I used to take it. So I encourage people to try different things, and one of the things that I would tell them is that if you want to learn how to deal with your pain so that it helps you in your life, you need to come and participate in the program. I actually have one of your cards that I carry around in my purse, and I gave it out and told them that they needed to call to see how they could get into the program. And usually one of the other questions that they always ask is, does the insurance cover it? I've been lucky, so my insurance was pretty good, so I haven't had any problem in that area.
Wonderful.
So, yeah.
And so how would you describe your function now compared to your function before starting the program?
From hopping to limping to not being able to work in my garden to not sleeping at night and waking up in the night needing to take medicine, to now I'm back in my garden. I'm not back in my garden every day, And as you know, when the weather comes on and it changes and it gets cold, things happen. But I get up, I have a regiment that they've given me that I do on a daily basis, a group of stretches that I do that really help me, that I can get up and I can get moving and I can go through my day without hurting. I've also learned about some things on my own by going to, I believe it's called Grassroots, which is a health store that's in the area not far from this organization. And I was able to find some different creams that have helped me. One is a CBD cream. And I was so excited because the first time I used it, it actually took the pain away totally, which allowed me to work in my yard. And that's what we want. I mean, we don't want to be in pain. No one wants to be in pain. And so as a result of being in the class and involved in the I call it an institute, or like taking a class at Cal State, but the class is benefiting you personally, and learning about your body and learning about the things that you need to do emotionally and physically to take care of yourself. The one thing I was not relaxing the way the mindful meditation teaches you to relax. I didn't buy peppermint oil. I certainly didn't buy, there was another one that was used. There were several oils that I'm not thinking of the names of them right now, but I wasn't buying them. Now I have all of them. Now I take the time to light candles, and I take the time to really sit and relax and take a warm, long, hot bath and use the oils that they've suggested along with the creams, and I have less pain. I'm taking hardly any medication, and it works for me. It's just absolutely, I'm so happy that I've done it that I asked if I could come back a second time. So I'm really pleased. One of the things though that I think is important is that little person that's in your ear, Dr. Z. I call him Dr. Z, everybody else calls him Zappaterra. But you sort of hear that voice in your ear because you have to have that support. And I think that as we come here and we get to know other people that are in the same situation, that also helps you emotionally. And it helps you to look forward to coming back and meeting up with the group that you're with and talking about the progress and how to do this and other suggestions. Everyone, there's something new to learn from everyone, and we're all learning together. But the most important thing is that we're learning how to take care of ourselves. And I'm still friends with a woman that was in my class. She was 81. I picked her up the other day. We went to lunch. I took her back to the Grassroots. We bought a special cream for her because she has myofascialgia, I think that's what you call it. And we bought that cream for her, and she called me the next day and she said, "It was wonderful. I have absolutely no pain." So I think the networking and us coming together here as the foundation of what's helping us, I think that's a real key of somehow seeing how we can keep those relationships going, because it's really helpful emotionally as well as mentally. I mean, those are part of the keys too, because the stress, the depression, the sadness, one thing I've noticed is a lot of us are 60 and over. Our kids are out doing whatever it is that they're doing, so we find ourselves home alone or home without other friends. Those are some of the things that you can tap into. Those people that you've met, you can come together with them. You can talk about that. You don't have to focus on the pain. There are other things to think about. There are other things to do. I think that's really important. I love it. I'm sold. I hope I'm not rattling too much, but I'm really pleased with it. And I was sad when he left and said he was going to go do research, because he was my doctor. But I see what his purpose was, and I'm really appreciative, and I'm very happy with it. So I'm going to try to stay in it as long as I can.